Hi, welcome to our program overview of the Case Western Reserve University Neuromuscular Medicine Fellowship Program at University Hospital's Cleveland Medical Center. My name is Komal Savlani. I am the program director of this fellowship program, and I will be starting off first with introducing you to our faculty who work alongside me during this one-year fellowship. I want to start by introducing our faculty. We have Dr. Bashar Katurji, who is our Division Chief of Neuromuscular Medicine here at UH. He is also a professor at the Case Western Reserve School of Medicine. He also directs the EMG lab and co-directs the ALS clinic with me. Next, you'll see a photo of myself. I am the program director of this fellowship and assistant professor at Case Western Reserve School of Medicine. I also direct the adult SMA clinic in addition to co-directing the ALS clinic. Dr. Barbara Shapiro is one of our faculty members and is a professor at the School of Medicine. She works with our fellows as well. Dr. Christopher Geiger is the Associate Program Director of the Neurology Residency. He is an assistant professor at the School of Medicine and helps to direct the Peripheral Nerve Center Clinic, which I will talk more about later in this presentation. Finally, on this slide, you'll see a picture of Dr. David Preston. He is our Program Director for the Neurology Residency. He is also a professor at the School of Medicine and directs our neuromuscular ultrasound lab. Next, we have Dr. Kamal Shamali. He is an associate professor at the School of Medicine. He's an autonomic specialist and the lab director of the autonomic laboratory. We have Dr. Mark Cohen. He's a professor at the School of Medicine and our neuropathologist with whom we review our biopsy slides with. Next is Dr. Patrick Fagan. He started working with us over the past year. He's an assistant professor at the School of Medicine. Dr. Robert Adams is one of our former graduates who now works at the Veterans Affairs Hospital, which is about 5 minutes walking distance from UH's main hospital. He's an assistant professor at the School of Medicine. He does ultrasound, EMG, and also is involved in peripheral nerve ultrasound rehab research. Finally, we have Dr. Amani Ramahi. She is also one of our neuromuscular faculty at the VA location and is an assistant professor at the School of Medicine. To round out our team, we have 9 EMG technologists, some of who are also autonomic technologists. We have 3 main neuromuscular secretaries and 2 neuromuscular nurses. Our faculty include leaders in neuromuscular medical education. They are the authors of some of the most widely used neuromuscular textbooks, such as Neuromuscular Disorders in Clinical Practice, a book that is authored by Dr. Bashar Katurji and some of his other colleagues, Electromyography and Neuromuscular Disorders, a book that's authored by Dr. David Preston and also Dr. Barbara Shapiro, both of whom are our faculty members. The book in black is titled Electromyography in Clinical Practice, and this is a case-based book on EMG and patient presentation authored by Dr. Bashar Katurji. And finally, you'll see one of the newest books authored by some of our faculty titled Neuromuscular and Electrodiagnostic Medicine Board Review, which is authored by Dr. Bashar Katurji, Dr. David Preston, and 2 of our former neurology residents. They also lead sessions at the annual AANEM meeting. They've been invited professors at other institutions. All of our faculty are involved in teaching the PGY3 neurology residents during their 8-week EMG rotation, in which our fellows also participate in teaching our neurology residents as well. Our fellowship is a 1-year ACGME accredited fellowship. It is very comprehensive. The atmosphere at our training sites, both the VA and university hospitals, is a very collegial atmosphere. Everyone is very happy to come to work and enjoys teaching our fellows and our residents. Our faculty pride themselves on being educators. The major site of training for our fellowship is University Hospital's Cleveland Medical Center, and starting this past year, we've also added on the Louis Stroke Cleveland VA Medical Center as well. In our clinics, our fellows will see patients with a variety of neuromuscular conditions, including neuropathies, neuromuscular junction disorders, myopathies, motor neuron diseases. We have a dedicated autonomic clinic as well as an ALS multidisciplinary clinic as well. Here at University Hospital Cleveland Medical Center, that is the location of our main campus. This is a main clinical training site for our fellows where we have an outpatient neuromuscular clinic space, EMG lab, autonomic lab, and ultrasound area. And all of those areas are within a hallway of each other. We also go to clinic at UH Chagrin-Minnoff, where we also have an EMG lab, autonomic lab, and ultrasound available there as well. We also see patients at UH Suburban, which has a clinic space, EMG lab, and ultrasound. And finally, we see our ALS patients in person at a location called UH Foley Elder Health. At the main campus is where we also do our inpatient consultations for neuromuscular. Our patients are housed in various wings of that hospital. All of the various towers are connected on the inside, so it's rather easy to get from one area to the other. We have patients in an area called Lerner Tower and Lakeside. Our women's hospital is called McDonald House. Our oncology inpatient wing is called Seidman Cancer Center. And finally, our pediatric patients are housed at Rainbow Babies and Children's Hospital. One of the really nice things about the main campus location is that our outpatient building and inpatient hospital admission floors are adjacent to one another. You don't have to walk outside or walk to a different building to get there. They are simply separated by a door, and so we can easily just go through our waiting room of our clinic and tap through a door, and we'll be actually in the inpatient side of the hospital. In addition, those other clinic locations are fairly easy to get to as well. None of the clinic locations are very far from main campus, and that is very helpful because our fellows can live in a variety of different areas around town. The other hospital that our fellows also have an opportunity to train in is the Louis Stokes Veterans Affairs Cleveland Medical Center Hospital. At that location, our fellows train in the EMG lab and practice doing neuromuscular ultrasound, as well as there are different research opportunities at the VA, including research in peripheral nerve. This VA site is a tertiary care VA hospital for the region. It is very close to the University Hospital's main campus location, about a 5-minute walk, and will just take you a couple minutes if one is driving from one location to the other. The nice thing about the VA hospital is that our fellows are exposed to a different patient population and get to see and work up various peripheral nerve conditions that are unique to the veteran population. One of the most important procedures that we teach our fellows is EMG studies. We have an AANEM accredited EMG lab. We began the year with a didactic curriculum on the basics of nerve conduction studies and needle EMG. We teach in a one-on-one apprenticeship style. We have 10 EMG rooms across 5 different sites. Our fellows become very confident in learning how to do both basic and more unusual nerve conduction studies, doing needle exam, learning how to do single fiber, learning how to do blink reflexes, repetitive stimulation, F waves, and H reflexes. We also teach neuromuscular ultrasound very comprehensively. We have a dedicated didactic curriculum and assessments. We teach in a hands-on workshop style with our fellows. We have 6 ultrasound machines across all 4 procedure locations. Our fellows will start by learning the basics of the ultrasound machine and recognizing what normal nerve looks like under the ultrasound, as well as normal muscle tissue. And from there, we progress and learn the basic nerves and their anatomy in the arm and leg, and then brachial plexus, and so on. Our fellows also get exposure to understanding and getting to see autonomic laboratory testing, including tilt table, QSART, Valsalva. At our main campus location, we also have a thermoregulatory sweat test area. Our fellows also will learn how to do skin biopsies, and one other procedure that our fellows will learn will be forearm exercise testing as well. Once our fellows have finished their year with us, and if they've taken their neurology board exam, they are eligible to sit for the ABPN Neuromuscular Board exam. They are also exposed to and complete a number of EMG studies that help to fulfill the criteria that is needed in order to sit for the electrodiagnostic board exam through the ABEM. And they also will complete a substantial number of ultrasound cases during their fellowship. There is a ultrasound certification that one can take after becoming ABEM certified. Our fellows participate in a very comprehensive didactic and conference schedule. On most Tuesday afternoons, we will review different neuromuscular topics. For example, recent topics have included metabolic myopathies, the CMT neuropathies, or the limb-girdle muscular dystrophies. On Wednesday afternoons, we do a combination of journal club or case conference or research discussion, review muscle and nerve pathology with our neuropathologist, or do skills workshops where, for example, we might practice ERPS point testing or repetitive stimulation or blink reflexes. Our fellows also attend neurology and neuromuscular grand rounds, and they also attend an EMG quarterly quality conference in which the EMG faculty, our EMG technologists, and our fellows all participate and attend. And what we do there is that we will review a number of different EMG cases and try to understand and learn from those cases, which is a great learning opportunity for our fellows. At University Hospital's case medical training site and the VA hospital, we pride ourselves on being educators, and our fellows are an integral part of our teaching environment. Our fellows help to teach neurology residents who are rotating through during their PGY3 EMG rotation. Our fellows also are involved in teaching the Case Western medical students during a case-based series that occurs throughout the year. Our fellows may also be involved in the EMG Tech Education Conference, which happens most years. In addition, our fellows have been asked to present at various conferences within the hospital, such as a rehabilitation department conference as well. Our fellows become involved in research of various topics. Recent fellow research topics have included ultrasound finding in gunshot wounds, the efficacy of neuromuscular ultrasound, studying a speech therapy technique for ALS patients, trying to understand the vagus nerve anatomy through autonomic study as well as ultrasound, peripheral nerve electrode rehabilitation for spinal cord patients. They've published their findings in various journals. They've also attended conferences and presented abstracts there. They've also participated in case conferences at the AANEM. Our faculty also lead clinical trials. So, for example, we've had recent trials on POTS, myasthenia gravis, and ALS, just to name a few. Our fellows are encouraged to attend conferences during the year. Typically, our fellows will choose to attend the AANEM, and the majority of them will also choose to attend the AAN. There may be other conferences that a particular fellow might be interested in, and we're always very supportive of their learning and exposure at various conferences or different courses, including the myology course offered through Ohio State. We've had several new and recent developments, including expanding our curriculum, such as adding in more skills workshops to help train on some more advanced techniques to do with neuromuscular medicine. Our fellows over the last couple years have been attending the autonomic quality meetings where autonomic studies are reviewed. We've also added additional faculty, including Dr. Patrick Fagan at University Hospitals and our 2 Veterans Affairs faculty, as well as added the Veterans Affairs Hospital as a rotation site. Our week at a glance. Our fellows rotate every 2 weeks to a month through a different combination of sessions. Each rotation is a combination of neuromuscular clinics, procedures, elective time, research. There's an emphasis on continuity of care, such that if a fellow has started seeing a patient in clinic with a particular attending, they will be able to easily schedule that patient and follow up throughout the year with that attending. In addition, if a fellow has seen a patient and there is an EMG to be scheduled, they'll be able to easily find a time in which they can do that EMG with that particular attending with whom they saw the patient with. All of our trainees are together for Wednesday afternoon teaching and didactic sessions. In addition, our fellows participate in a neuromuscular inpatient consult service at the main campus. And during that time, essentially almost all of their clinics and procedures will be at the main campus for that particular month to allow for ease of seeing consults as they may come up. And usually that's about 3 to 4 months out of the year. The way our schedule is set up is that at the beginning of the year, a schedule is made for the entire year, and our fellows rotate through a combination of clinics and procedures and research and elective time. For example, in example number 1, you'll see a fellow who begins the week by doing EMG sessions, then on Tuesday doing ALS clinic, on Wednesday doing morning neuromuscular clinic, on Thursday doing EMG and ultrasound, and then clinic in the afternoon, and then on Friday doing clinic followed by ultrasound. Typically, the way that each day is set up is that both the morning and the afternoon session are at one site, so a fellow does not have to travel between 2 sites. Example 2 shows that a fellow is starting off the week by doing clinic in the morning time and then doing autonomic studies or skin biopsies in the afternoon, practicing ultrasound on patients on Tuesday, doing clinic on Wednesday. On Thursday, there's a combination of EMGs and clinic in the morning, followed by EMG, and then ending the week with EMGs on Friday. Example number 3 includes a fellow who is assigned to do autonomic clinics on Thursdays with a combination of clinics and EMG on the other days, as well as a time to do research on Monday afternoons. Our fellows care for a very diverse patient population. All of our sites of training are in Northeast Ohio. The patient population is diverse in terms of socioeconomic backgrounds as well as cultural backgrounds. And by rotating at the university hospitals locations as well as the VA location, they're also exposed to a veteran population as well. The neighboring states to this area of Ohio include Michigan, Pennsylvania, West Virginia, Indiana, and New York. And we do get patients at both university hospitals and the VA location who will come across state lines to see our faculty at those locations. Our UH location accepts all major insurances, and at UH, our fellows will rotate through our tertiary care main campus location and 2 other satellite offices at UH Suburban and UH Chagrin. And finally, they see ALS patients at a location called University Hospitals Foley Elder Health. At the Veterans Affairs location, our fellows rotate through their tertiary care center, which is called the Louis Stokes Cleveland Medical Center. Living in the greater Cleveland area is the best of living in a city. We have many different things to do for different hobbies that people may have or interests. If one is interested in the arts, there's the Playhouse Square, in which you can go see Broadway plays or performers come there, or dance troupes, for example. The Cleveland Orchestra plays for the majority of the year at Severance Hall, which is the picture on the top left, which is actually across from our main campus location. We have many different types of museums, the most famous of which is probably the Rock and Roll Hall of Fame. The Cleveland Museum of Art and Botanical Gardens are down the street from our main campus and are beautiful to visit. We also have a lot of green spaces, including the Metro Park system. On the top right, you can see a picture of one of the Metro Parks. There's a lot of great hiking in those areas. On the bottom left, you can see a picture of a different Metro Park called Edgewater, in which you could walk or bike along the lakefront or go to the beach in that area as well. The School of Medicine at Case Western is down the street from our main campus location. And the main campus is actually situated itself on the Case Western Reserve University campus, which affords with it lots of perks as well. University Circle is an area which is down the street from us that has the Cleveland Museum of Art, Botanical Gardens, and other museums there. Cleveland is affordable to live in, it's easy to travel through, and there's lots of different neighborhoods that can cater to different needs that someone may have. Here are some more pictures to give you guys a taste of Cleveland. On the top left, you can see a view of the outside of the Cleveland Museum of Art. On the next picture over, you can see a group of individuals in one of the galleries in that museum where they're interacting with a giant screen of a painting. The next picture over is of the West Side Market, which is in Ohio City. That is right outside of the downtown area and is a really fun place to go visit. Has lots of different food booths there. On the bottom left, you'll see a picture of the Rock and Roll Hall of Fame. And on the bottom right there, you'll see a picture of the Playhouse Square area. That again is a giant building that houses multiple theater houses that can play Broadway plays, other plays, dance troupes, performers. They all come there, and it's a real joy to attend those performances. After fellowship, our fellows go on to become leaders in their region in neuromuscular medicine. Many of them hold leadership positions nationally or internationally, and they practice in a variety of different settings or do additional fellowships after their year with us. The different settings can include academic institutions, community neurology-based practices, hybrid settings. Some of the additional fellowships our fellows have done include neurogenetics, advanced ear and peripheral nerve, neuro-oncology, and neurocritical care. Here are some pictures from 2023 with our current fellowship class. We had a holiday bowling party with our fellows, attendings, secretaries, nurses, and EMG and autonomic techs. And we have a couple photos from AANEM that happened in November of 2023 where our fellows had a chance to present posters, and some of our fellows also had a chance to present at sessions. To summarize, we have a very comprehensive fellowship year. We have a very collegial atmosphere. We enjoy coming to work and working with each other and working with our fellows. Our clinic training program is very comprehensive. We have a very diverse patient population in terms of conditions and backgrounds. We teach EMG very comprehensively, as well as ultrasound. We also teach advanced EMG techniques. We have a very multifaceted didactic and workshop schedule for our fellows. Living in Cleveland is the best of living in a city. It's affordable, easy to travel around, and there's a lot to do. Our fellows graduate confident neuromuscular physicians, and they are ready to practice in a variety of different settings, whether it's academics, hybrid, or non-academic. Thank you so much for your time today. If you have any questions at all, please reach out to us. Listed here is my email address. I'm Dr. Komal Sablani, the program director. Tyrika Allen is our program coordinator, and you are free to reach out to either of us regarding any questions you have. Thank you so much for your time today.